Hi, I'm Sally Macdonald, a longtime Yukoner for over 40 years now, and I'm one of the physicians who do assess the MAID up here in the Yukon. So with every community, there is a nurse here in the Yukon, and we have nurse practitioners in some of the communities, and we have physicians in the three largest places here in the Yukon. And as well, physicians go up to small communities. So it's very easy for people in different communities to reach out to speak to one of the health people and the physicians or nurse practitioner who are doing the MAID. So that's very straightforward. We do not have a formal group here in the Yukon. Everything is done by word mainly. And so if you reach out to a nurse practitioner or a nurse or social workers or other, or particularly your family doctor, you can easily then reach forth to get the information folks who are doing the MAID. If you're in the hospital, it's very easy to reach forth, particularly to the doctor who's looking after you or the nurse who's looking after you. And you can just ask about that at any time, and they will activate the MAID or just speaking with anybody about it. Also, if you are feeling really ill or just don't feel that you can reach out to people to discuss about it, and you want your family to start or close friends to start that's fine as well, to at least start the process. You, of course, have to do the forms, but you do not have to reach out and say, I need somebody to come and talk to me. So there is this form that you do have to fill out, very short form, that it's just a form asking the request to go ahead with the MAID, and that's the way to start the whole process. Here in the Yukon, if you're in the hospital, we can just give it to you, but it's also in the Yukon government MAID. You just go into the computer and say Yukon government MAID, and you will find the form right away. And if that's hard for you to do, there are lots of people who would do that for you and reach out for that. If you are in a situation where you are unable to write this or complete this form and somebody else has to do it, it can't be anybody who may be involved in the will at the end. So particularly family members or very, very close friends. So people who will not be involved with the will after your death, then you can have somebody else to do the form for you. Otherwise, you can do the form. In places like the Yukon, a lot of people don't want to have many people knowing what's happening, and they often don't have a lot of close friends to come in and witness this. So they've made it, instead of two people, it's now just one person. And they also have allowed people like the nurse that's working with you or the people who have been working with you closely in the health system, that they can be there to witness. Once you've completed this form, it's important that you keep it in a place that you know where it is until the nurse practitioner or the physician who is going to assess the situation arrives. When they arrive, you would hand your application to them. So when it comes time to discuss the situation with the nurse practitioner or the physician, generally, I know a lot of people wish to have their family or close friends with them. And we are certainly fine with that while we go through a large part of what's involved with MAID. There often is a period of time when we just want a little private time for you to be sure that this is your decision and completely your decision to go ahead. As well, if you have other people present that you wish, like a social worker or your family doctor, close others, we're very open to have them all together for what you need. It's your decision. As typical Yukons, we are very open to any place that you wish to have the MAID. I know already we have had a very strong variety of places. And the one thing is, we've been grateful that we've been able to even go to communities that don't have physicians or nurse practitioners to do the procedure, and to offer people to be at their own home rather than drawing people into Whitehorse just for that. So that's quite open as to what you wish to be doing. We're also very open as to who you wish to have there at the time of the MAID. And if you wish to be outside, that's very fine too. It's all about what you wish. In general, most of the time that we as physicians or nurse practitioners have done our own procedures, sometimes people wish to have nurses present to do the IV, but most up here in the Yukon, most of the physicians do their own IVs, but it's a variety. And sometimes what we do is have the IVs a period of time before the MAID, so that we're not we're doing a medical thing at one moment, and then the procedure, which is a very spiritual thing, at another time. So sometimes we do that as well. We always put in 2 IVs just for protection if one of the IVs do go. I do want to just mention a bit about the death certificate, because people often ask, is it going to be on the death certificate? So what it is we do have to put it down on the basic certificate, but for the formal one that everybody gets, it is not in there at all. And what's put in is what the medical problem was, so that MAID is not mentioned whatsoever. I thought that a lot of people get concerned about that. And the other thing is the funeral home. You can choose to call the funeral home ahead of time or the funeral home afterwards. It is worthwhile talking to the funeral home to give the information that you wish at end of life.